Welcome to the deep dive. Today we're looking into something, well, really vital yet maybe not talked about enough. The potential long-term impact of high blood pressure medication on sexual health.
Right. It's a sensitive topic.
Absolutely. And look, we all know these medications are crucial, absolute lifesavers for many people managing heart health.
Totally essential. Yeah.
But our aim today, using Ruddock's Lowering Blood Pressure Naturally as our guide, is to explore that less discussed side. How these meds might affect our intimate well-being over time.
Exactly. Seeing the bigger picture.
We know you want the real info,
Yeah.
but without getting bogged down in super technical stuff.
Yeah.
So we're keeping it focused.
Good plan. Because while getting that blood pressure number down is priority one, we do need to be aware that treatments can sometimes, ripple outward.
Rebel outwards, yeah. Affecting quality of life, including something as fundamental as sexual health.
Precisely.
Okay, so let's get right into it then. According to the source, how can these life-saving drugs potentially lead to a decline here?
Well, the source points to a few key things. One big factor seems to be reduced blood flow.
Okay.
So medications like beta blockers, maybe diuretics too, they're great at lowering overall blood pressure, right? But they can also sort of decrease the blood flow specifically to the sexual organs.
Okay, like side effect of the main action.
Yeah. And what's interesting is how it shows up differently. For men, it might be erectile dysfunction. For women, it could be issues with arousal or lubrication.
Right, so it's a direct physical thing, the mechanics.
Yeah.
Does the source mention other ways these meds might interfere?
It does, yeah.
Yeah.
It also talks about potential changes in nerve sensitivity.
Nerve sensitivity, how so?
Well, the idea is that some medications might sort of dull the nerve responses a bit, which would directly impact, feeling pleasure, achieving orgasm.
Wow. Okay, so it's not just about blood flow getting there, it's also about the actual sensation when it does.
Exactly. It's the whole sensory experience, too.
That's a really crucial distinction. The source also touches on hormones, doesn't it? I think I remember that.
It does, yeah. Long-term use of certain types of these medications could potentially disrupt your hormonal balance.
How does that play out?
For men, it might affect testosterone levels. For women, maybe estrogen. And since those hormones are pretty key for libido, for sexual desire.
Any interference there is going to have a knock-on effect.
Definitely. It can lower that drive.
Gosh, it sounds like quite a combination of factors then. You've got blood flow, nerve response, and hormones potentially being affected.
It can be, yeah. A confluence, as you say.
And as if that wasn't enough to deal with, the source also brings up the psychological side of things.
Oh, absolutely. That's huge. When someone starts experiencing difficulties with sexual function, it's understandable, right? It can really knock your confidence.
Yeah,
It can lead to anxiety, maybe stress in the relationship, even depression sometimes. It sort of becomes this cycle.
Where the physical problem affects your head, your emotions.
Exactly. And that, in turn, can make the original physical problem even worse. It feeds itself.
That really drives home the point, doesn't it? That sexual health isn't just some optional extra. The source really emphasizes its core to our overall well-being.
Absolutely. Ruddock's work is quite clear on that. It frames sexual health as integral, part of our overall happiness and quality of life.
So overlooking these potential side effects means we aren't really looking at the whole picture of health.
That seems to be the argument, yes. Addressing health comprehensively.
Now, the really crucial thing here, and we need to be clear, the source isn't saying stop taking your medication. Not at all.
No, definitely not. That would be dangerous advice.
It's more about awareness, right?
Yeah.
Exploring all the options. The source actually offers a more kind of proactive approach.
Yes, it does. It really emphasizes the potential for managing blood pressure naturally. Things like lifestyle changes, focusing on diet, stress reduction techniques.
Things we hear about often, but maybe don't connect directly here.
Right. And even things like fasting are mentioned. The core idea is that by tackling the root causes of the hypertension itself.
Through these natural methods.
Yeah, individuals might find they can protect both their heart health and their overall vitality, including sexual wellness. It's about finding that balance.
Okay, so boiling it down, the big takeaway is blood pressure meds are vital, crucial for many, but we should be aware of these less discussed potential effects on sexual health.
Exactly that. Awareness is key.
And it prompts a really important question for you listening.
Yeah.
Given this info, can you perhaps proactively explore some of these natural avenues to support your cardiovascular health and maintain that overall sense of well-being?
It's definitely food for thought. A conversation maybe worth having with your doctor, too, about your specific situation.
Absolutely. And if you do want to delve deeper into this specific perspective, Dale Ruddock's book, Lowering Blood Pressure Naturally, A Patient's Guide to Hypertension Management, that's the source we've been discussing today, might be a useful resource.
It just shows, doesn't it, how interconnected our health really is. Everything impacts everything else.
So true. As you continue on your own health journey, remember to consider, well, all the different aspects of your vitality. It's all part of the bigger picture.